Here for Facebook Live for the next hour to take your questions and give the best answers I can on any issues that you would like. As you know, we have had to introduce additional public health measures tonight to protect our healthcare system and lives during this really serious spike in COVID cases. Happy to answer questions on that or anything else. Please just plug questions into the comments section below. Looking forward to any questions that you've got. So I don't know if we missed the introduction. I thought I had a glitch there. Jason Kenney here, starting a Facebook Live for the next hour or so to take your questions on any issues that you like. Please just enter them into the comments section below. I'm here at the Premier's office in Calgary. As you know, I just made a statement about some additional very difficult public health measures that we have had to introduce to protect our healthcare system from the huge surge in COVID-19 infections that are happening in Alberta. Unfortunately, we now have by far the highest total case count and relative active daily cases in North America. And if the current trends continue, they will without a doubt pose a massive threat to our healthcare system, forcing widespread cancellation of surgeries and other healthcare procedures. We cannot allow that to happen. We have to stop the spike. And if we can just dig deep and do that over the next 3 weeks or so, the vaccines, we believe, will catch up and will take over effectively and start to interrupt the chains of transmission, which right now are driving more people into our hospitals, particularly intensive care. Again, if you have questions, please just put them in the comments section below. Looking forward to, here we got our first one that I can see. Lori Lori says, wedding ceremonies, how many people? That's 10 people, unfortunately, limited to wedding ceremonies, Lori. That has not changed, so that's been the case now since December. These measures are in place for 3 weeks, a minimum of 3 weeks. We'll be able to reevaluate after that, and I really hope that we can significantly increase the numbers for things like wedding ceremonies in the summer. But we've got to get on top of this right now, and especially if they're outdoor wedding ceremonies in the summer. But right now it's a limit of 10. Denise Williams-Bouteau says, can kids go to school Friday? Denise, we are unfortunately having to go to online instruction for kindergarten to grade 12 across the province, starting on Friday. So Thursday afternoon will be the last time for in-class instruction until Tuesday the 25th, I believe it is, the Tuesday following the Victoria Day May long weekend. And let me just explain that I know this is the most challenging part of today's measures. We absolutely don't do it lightly. It's a great disruption for parents. It also can be a great disruption for kids. We've done everything we can, especially in K-6, to keep the schools open for in-classroom instruction, as they have been since last August. But the problem we have now is really a functional operational capacity in the school system. We have about 80,000 students, teachers and staff who are on self-isolation right now, which is over 10% of the entire school population. And with the exponential growth in community viral spread, we expect that to become 20% of the school population before too long. We just cannot operate the schools with adequate teachers. We have more and more supply teachers who are unavailable. And so what we're hearing from superintendents and school boards is that we're coming very close to effectively not being able to operate and provide for in-classroom instruction in many, many schools across the province. So rather than just a kind of slow grind of suspending more and more classrooms in schools, we have come to the conclusion that the best approach is a province-wide reset of 2 weeks to permit for some online or at-home instruction, and then for all the kids to come back from K-12 on May the 25th to ensure that they can finish the last several weeks of the academic year. We want to maximize in-classroom time, and we think this is frankly the best way of doing it, to have that reset so everybody can come back They don't have to be self-isolated. Hopefully by then we will have started to see the curve bend down, community transmission rather be limited, and be able to go forward from May 25th to the end of the school year. Amy Elizabeth says, why are malls still open but schools aren't? Well, Amy, malls are now, all stores are limited to 10% capacity. And in fact, we're going to have even tighter rules on the common areas in malls. They're not going to be able to include that they're common areas in the 10%. But here's the challenge that we have. We spent a lot of time in cabinet deliberating on this. I know that symbolically it looks difficult, but that people can still walk into a shopping mall. But here's the problem. People need to buy groceries. They need to buy pharmaceuticals. They need certain, medical or paramedical equipment. They need, maybe if something breaks down in their house, hardware. There are a lot of essential things that people simply do need access to. And so we just cannot, even in the toughest kind of restrictions, shut down access to all retail. So people need to be able to access at least grocery stores, pharmaceuticals, perhaps hardware stores, medical equipment stores, and so forth. And if that's the case, then they can go to places like Walmart and Costco. But Walmart and Costco sell a lot more than those, quotes, essential goods. And then if you end up closing all other retail, including clothing stores and shopping malls, what you're doing is sending all of that business to a couple of big box stores or to Amazon. And we just don't think that is justifiable or fair. We think a 10% cap is extremely limited. We urge people not to go for non-essential shopping trips over the next 3 weeks. But we didn't want, I think about the fifth generation jeweler in Innisfail. If we were to shut them down because they don't sell food or pharmas, well, people can go and buy jewelry at Walmart or Costco, and that would forever, that's just a mistake we made last spring. We don't want to repeat it. But in terms of the schools, again, the challenge there, it's not actually a risk to the health of children, although in a tiny number of cases, kids can get sick from COVID, especially these variants. Nor is it really an issue about in-class transmission, because we have fewer than 3,000 confirmed cases of in-classroom or in-school transmission out of a population of 720,000 students, teachers, and staff. So it's less than 0.5% who have been affected apparently by in-school transmission. But rather, it's just an operational challenge that we have with 80,000 students, teachers, and staff on self-isolation to follow the public health protocols. And this is going to grow with community transmission, and very soon we'll be unable to operate many of the schools. So recognizing that, we thought the best thing right now to do is to hit the reset button, as it were, allow for a 2-week latency period where hopefully we see much lower transmission. Kids can come back into in-classroom instruction 2 weeks from now. It's critically important that they do so. All right, Braden Criddle, says, how do you compare Alberta to Texas? Please explain how and why Alberta is so different. That's a very thoughtful question. Thank you, Braden. So first of all, Texas has experienced about 4 times more deaths per capita than Alberta through COVID. They've experienced, and you can go and look up just Google Texas government COVID website or data site. And so you don't have to believe what I have to say on this, but their own data tells you that they've lost 50,000 lives to COVID out of a population of 29 million so they've lost about 145 lives per 100,000, whereas Alberta has lost just over 2,000 lives out of a population of 4.4 million. So we're closer to, I think, about 43 deaths per 100,000. So their death rate is 3-4 times higher than ours. That's point one. And that's what I'm trying to say there is Texas is hardly a model for us to emulate. Secondly, I think what you're probably referring to, Braden, is that in the second week of March, Texas eliminated pretty much all public health restrictions, and they have seen their case numbers and hospitalizations continue to come down. In fact, yesterday, Texas reported, I think, only 1,300 new daily cases, whereas Alberta reported 1,800, even though their population, again, is 29 million, and ours is 4.5 million. So we are experiencing about 40 to 45 cases per 450 cases per 100,000. And Texas is experiencing 45 cases per 100,000. So we're about 10x the number of new daily cases. Their cases are going down, ours are going up. That's why we are imposing restrictions, and they don't need restrictions. Why are their cases coming down, even in the absence of restrictions? Well, clearly the primary reasons are the combination of a much more advanced vaccination program, plus the impact of antibodies through prior natural infection. It is estimated that Texas and similar states had about 1/3 of their population with some degree of natural immunity through antibodies acquired through prior COVID-19 infection by the end of March, beginning of April. So that's 1/3 that already had some substantial protection. By that point, they also had, by the end of beginning of March, they also had about 15% of their population vaccinated with at least a first dose. So that is to say that about 47% of their population had some degree of protection. Right now, we have about 30% of the total population with the first dose, and about 10% with some natural immunity, so 40%. So we're finally starting to get to where they were 2 months ago. Okay, so they had let's put it this way, they had about a 2.5 month to 3 month head start on Alberta, and that's for two reasons. One, higher natural infections, the cost of which was a death rate 3 to 4 times higher, and B, a much higher level of vaccination because the U.S. Produced its own vaccines, and we Canadians, of course, have been struggling to get supply. One other factor I would raise with Texas is, two other factors, excuse me, is that they have better weather, and that makes a difference. People being able to get outside and avoid indoors, which is a much higher risk for transmission. So their warm weather helps. And lastly, they have a much larger healthcare system with far more staffed healthcare beds. I am told that Texas has over 7,000 fully staffed ICU beds on a population of 29 million, whereas in a normal year, we have under 200 fully staffed ICU beds on a population of about 4.5 million. So you can work out the per capita difference. Texas and the US spend about 17% of their economy on healthcare. In Canada, we spend about 11%. Healthcare is big business in the United States, all of which is to say that they have had much more flex capacity to take a higher risk tolerance in driving the numbers up. We don't have that flex capacity in our healthcare system. So those are the main differences. Chantel Lobb says, why don't we just keep kids home for the rest of the year? Our kids are being affected by going online and going back. Is this something we're looking at? Well, Chantel, thank you. It's a thoughtful question. And there has been a growing body of research around the world indicating that children have really been set back probably for a long time through online instruction, particularly younger elementary school children. Secondly, obviously for many families, they are not structured to have a parent at home providing at-home care and supervision of online instruction for a prolonged period of time. Single breadwinner families or double parents, both parents working outside the home. So, we believe the schools are safe. There have been, in fact, statistically, the regular flu influenza is a greater threat to child mortality than COVID-19. Now, caveat that may change a little bit with the current variants, which do seem to affect younger people more readily. But generally, COVID-19 poses very little risk with respect to severe health outcomes for children. Children also are less likely to transmit than adults, and as Dr. Hinshaw has said repeatedly, reflecting the public health scientific consensus across the world, children are not, in classroom instruction is not a big vector of transmission. Generally, kids bring COVID to the school, not take it out of the school. So we've only had I think about 2,800 confirmed cases of in-school transmission since Christmas out of a population of 720,000. So basically less than a half of a percent of those 720,000 students, teachers, and staff have been affected by in-classroom or in-school transmission. So in-school transmission is not really the problem. The problem we have now is just an operational staffing problem as more and more teachers and substitute teachers have been sidelined through self-isolation protocols with 80,000 student teachers and staff on self-isolation. And that number is clearly going to grow with the current exponential spread that we are experiencing. So really, the education ministry came to cabinet and said that we are going to have rolling shutdowns of schools because of these staffing and operational problems. We recommend just one big reset across the province, let things cool down, bring everybody back in 2 weeks and get through the rest of the year with high quality in-classroom instruction. We'll also make up for some of the lost time in the fall with additional programming, especially for kids who might be further set back in their learning. All right, Katie Green Penner asks, do you really want a new base of supporters? Which people would you prefer? I think, Katie, that comes from a completely false story that somebody sent me a link to online that alleges I said something like that in caucus, in my United Conservative caucus. So let me be clear. When I was talking to my caucus recently, I told them that I had about a number of death threats that we've been receiving. I stepped out of a news conference the other day, got a message from somebody saying, quotes, um, uh, you will be executed for your crimes against humanity, Kenney. And then shortly thereafter, I got a message saying that, quotes, we know where your mother lives. So that was a implicit threat against my 83-year-old widowed mother who lives alone. And um, and I said to my caucus, I talked about that. I talked about some of the insane conspiracy theories. And I said, these people are not our base. These people, we don't want people making death threats, people threatening to lock up Dr. Hinshaw, people organizing rallies with tiki torches based on the neo-Nazi rally in Virginia. Those are not our supporters. Those are not Alberta Conservatives. Those are not mainstream Albertans. Those are voices of extremism and hatred. And no political party wants people promoting violence and that kind of craziness, period. I have always said, Katie, that I invite and welcome a widespread debate on COVID. I totally accept and, in fact, invite voices who strongly defend freedoms and liberties. I've always said that I'm proud and glad to live in a province where there's a lot of people who jealously guard their own freedoms and are understandably skeptical about the overreach of government authority. And I have clearly defended that in my own United Conservative caucus. I've been viciously attacked by the NDP and others for having permitted and tolerated that kind of debate, even in my own party and caucus. So I welcome a breadth of views. I acknowledge there are many legitimate different takes on what's the best COVID policy. That's not what I was commenting on. What I'm commenting on are people threatening violence, threatening to lock up the chief medical officer. I'll give you an example of the kind of kookiness that I'm referring to. The other day, we had there was, as you know, this protest up in Bowden, and the organizers of that protest. I'm just going to quote here, if I can find this. I'll have to come back to it, but so some of the comments that they're making are like just tinfoil hat crowd stuff, and that's not where Albertans are. So Albertans are regular people who want to do what's necessary to protect our healthcare system, to avoid large-scale preventable deaths, but also to minimize the negative impact of restrictions on our broader society. Within that, there's going to be a lot of different views which are perfectly legitimate and which I welcome. All right, Kay Leah Spallion says, what communities are exempt? Why? And are they exempt from all restrictions? Thank you. So, Kaylee, as you know, there's been a lot of discussion about the desirability of having some kind of regional variations in the policy on COVID in Alberta. And we've taken many different looks at this. We recognize that in some communities there is very little spread, and very few absolute numbers that don't pose a pressure point to the healthcare system. And so what we've done is to articulate that most of the measures announced today um, only apply, excuse me, they apply province-wide except for in communities that have 50 cases per 100,000 or fewer, and have a floor of at least 30 active cases. So that is a list of about 29 communities right now. I'll just quickly, these are, when I say communities, these are what we refer to as local geographic areas, and I'll just quickly rip through the list. In fact, since our team got a copy of this list, perhaps you could copy and paste that in the comments section below for people, just to show you which communities are exempt from the measures introduced today. But they include the MD of Acadia, Ranchland, Saddle Hills County, Kananaskis Improvement District, Birch Hills County, City of Lloydminster, Special Areas Number 3, Woodlands County, Municipality of Jasper. I'm glad to see that because they had been heavily affected before. Starland County, MD of Opportunity, County of Two Hills, County of Northern Lights, Thorhild County, County of Newell, County of 40 Mile number 8, County of Paint Earth number 18, Municipal District of Spirit River number 133, Special Areas number 4, MD of Provost, MD of Smoky River. That's good to see as well because they had been hard hit before. Special Areas number 2, Municipal District of Fairview, Vulcan County, MD of Pincher Creek, MD of Greenview, MD of, Municipality of Crow's Nest Pass, Lamont County, County of Minburn, Town of Drumheller, Smoky Lake County, Northern Sunrise, Lac St. Anne County, Flagstaff County, and MD of Bighorn. So those are the areas that are currently have fewer than 50 cases per 100,000, which is the key threshold that we follow, frankly, right across Canada for kind of hitting critical mass. And they have a floor of under 30 cases in each of those areas. Okay, Derek Fuller says, why don't you enhance the ICU capacity in the last 14 months? Well, we have, Derek. We've almost doubled it. So in a pre-COVID, we would normally have about 190 staffed ICU beds in Alberta for our 100 hospitals. And usually they'd be operating at, I'm told, depending on the time of year, sort of 70 to 80% capacity. Right now, between COVID and non-COVID patients, we have about 210 people in ICU. So we're already past what would be the normal capacity, but we've built in more and more capacity. We have the ability to surge to as many as 425 beds. So we have, Derek, we have more than doubled the maximum capacity. You might say, well, why don't you go even bigger? And is it just a question of like more beds? Well, no, it's not a question of physical space really, as much as staff. So we have built out flex physical capacity. You may know that we've set up the Butter Dome at the University of Alberta as a potential overflow unit. We, in the spring of a year ago, we worked with Sprung Structures to set up a kind of ambulatory hospital space for overflow next to the, I believe, the foothills. And we have other sort of extreme scenario planning, including using Red Cross tent hospitals if necessary. But we could like install thousands of beds in emergency structures. But the problem isn't that. The problem is staff, particularly with respect to ICUs, because the kind of clinical interventions called for to respond to COVID patients in intensive care require certified intensive care nurses, respiratory therapists, and anesthesiologists in particular to assist with things like intubation, basically hooking people up to ventilators. And there is a scarce number of respiratory therapists, anesthesiologists, and ICU nurses in Alberta. We've done everything that we can with basically like unlimited budget. We spent billions of dollars on all of this to increase that workforce. We have tried to accelerate the training of respiratory therapists and ICU nurses to accelerate their certification. We've tried to bring back retired staff. We've tried through incentives to move part-time workers in these and other health trades up into full-time. And actually, to tell you the truth, what we've been experiencing lately is the opposite, which is some of our ICU nurses are so burnt out over the past year, especially in our busiest urban hospitals, that some of them are leaving ICU. They're just tired. And some of them are thrown in the towel and going to more regular work. And I don't, by the way, this is not to be critical of them at all. I understand the pressure, but I'm explaining the challenges we have in maintaining and expanding that workforce. If it was only Alberta facing this challenge, then maybe we could hire people from abroad and rush their certification, hire people from other provinces. But every other place has been facing a similar challenge. You may realize that Ontario recently, they had doctors and nurses with these skills flying in from Atlantic Canada because they were hitting the maximum of their ICU capacity recently. So I guess my point is we have plans to expand our capacity from a normal 190 ICU to 425, but we realistically think that's as far as we can go. And there's also a very large price to be paid in creating that surge capacity, which is mass cancellations of surgeries, because what we have to do is take over surgery wings and wards and equipment and staff, transition them into handling intensive care cases for COVID patients if we reach that kind of worst case scenario. So you ask an entirely reasonable question. And again, the best answer is that we've more than doubled that capacity. That is we think that the very best we can do with a finite workforce. And it comes at a very great cost. If you know anybody who's waiting for surgery, and we surge up to 300-400 ICU COVID cases, then I guarantee you the friends you have waiting and the loved ones you might have waiting for surgery could be postponed for months. We don't want to do that. All right, Heather Broutrud says, why not open up vaccination to whoever wants it, especially the highest group of cases is the age group not able to get vaccines? Great question, Heather. All I'll say is I will just say stay tuned. We'll be making an announcement along those lines in the very near future, like hopefully this week. And the point is that we have, first of all, we wanted obviously to focus the vaccination program on the people most likely at highest risk of death or serious negative health outcomes from COVID-19. And that meant people, the elderly, it meant people with serious chronic conditions in particular. It also meant Indigenous people because they have sadly, much worse health outcomes. So that is why we've prioritized the elderly. And you know what? I think we were right to do so. I'll give you one hopeful sign in the difficult period we're in is this. The ratio of COVID cases that end up being hospitalized has been coming down. That's good news. And that is because we've been vaccinating the people most likely to be hospitalized. Now, having said that, now that we are getting larger and larger shipments of COVID, and now that we have vaccinated, I think 63% of the population over the age of 65, we feel that we can move forward with offering this vaccination to the whole population over the age of 16 in the very near future. Stay tuned for that. All right, Trevor Iwaschuk says, why haven't you shut the borders down? Well, Trevor, the international borders are the responsibility of the federal government. I believe they effectively should have shut those borders down 14 months ago. One of the reasons East Asia, Japan, South Korea, Taiwan, Singapore, have managed to get through COVID with almost no cases, very low deaths, and very few restrictions is because they were not naive. They didn't listen to the World Health Organization, and they didn't preach homilies of tolerance and so forth like the Trudeau government did 14 months ago. about border closures from COVID hotspots. They just did what common sense instructed they should do, and they shut those borders, and they kept COVID from coming in. Australia and New Zealand, of course, have done the same thing. But we didn't. That was the federal government's decision. There are more stringent border control measures now, which I think is broadly a good thing. In terms of interprovincial borders, I think it would be just about impossible to police that. Can you imagine us having police doing border screening and turning every non-Albertan back at the Alberta-BC border or the Alberta-Saskatchewan border, the city of Lloydminster? I think that would be functionally impossible. And quite frankly, right now we have much higher case counts than they do, and I think they'd be more prone on closing their borders from Alberta than vice versa. Levi Vasaya says, why do you think the broad public is not buying into the restrictions that are in place? Well, Levi, actually, I think the broad public is. I think we have a problem with non-compliance, obviously. I think it's probably a bigger problem than elsewhere. I say that because our neighboring provinces of British Columbia and Saskatchewan have broadly similar restrictions to Alberta's. We just enhanced ours tonight. But they have similar restrictions, more stringent in some areas, and yet their numbers are going down. Scott Moe just announced a path forward for relaxing restrictions. So if we have similar policies on COVID to those provinces, but our numbers are skyrocketing and theirs are dropping, I infer that we have a significant problem with compliance. I think it's coming from a minority of the population. And Levi, my observation is this, and I'm sure you can see it on the comments board below me as I speak on Facebook here, but there are a lot of Albertans who are in COVID denial. They don't believe anything the mainstream media says. They don't believe what the government says. They've just tuned it all out. They're just tired of it. They're fatigued. It's all background noise to people, and so I think there's just a small minority of the population who are kind of, creating their own reality based on the Facebook pages they follow or whatever silos of information they're getting. And maybe they're acting accordingly. And that's one of the reasons that we've announced today that we will enhance enforcement measures. We are doubling the basic ticket fine for public health violations from $1,000 to $2,000. We've also announced that we will be withholding Alberta registry services from people who have not paid those fines. Just like if you have an outstanding speeding ticket, you're not going to get your driver's license renewed until you pay that fine. Well, if you have received a fine for endangering the health of fellow Albertans by violating sensible public health measures, you'll be in a similar situation. Similarly, we just approved today a protocol between the Departments of Justice and Solicitor General, the Department of Health, and involving all of the law enforcement agencies to cooperate much more closely on more assertive prosecution of serious repeat offenders against the public health measures. So we hope that those enhanced enforcement measures will send a strong message that we will not allow a tiny number of freeloaders to basically flagrantly endanger our hospitals and our healthcare system, while the vast majority of Albertans make sacrifices to follow the rules. Jeff Binks says, what happens after May 25th? Are you anticipating a gradual reopening or thanks to 3 more weeks of vaccinations, a rapid return to where things were prior to today's announcement? Great question, Jeff. The honest answer is we just don't know for sure. So I'm not going to make promises that we can't be sure of keeping. And one of the reasons for some degree of uncertainty is just the threat posed by the variants, in particular the P1 Brazilian variant, about which I'm quite concerned. I think on Saturday we reported 340 new P1 variant cases. The P1, if you guys are interested in this stuff, just Google Brazil COVID, and you will see they've been living through a bloodbath. They've been experiencing 3,000 to 5,000 daily deaths in that country for much of the past month. It is they're incinerating bodies in hospital parking lots there like they are in India. and I don't say that to gross people out or to scare people, but just to say that's the reality of the P1 variant or the double mutation variant in India. They spread very quickly. They attack younger people. And in the case of P1, it can pierce natural immunity, the antibodies that people have acquired. It appears that some of the vaccines may also be less effective against the P1. So that's why I'm not going to make any absolute statements of absolute certainty here, period, paragraph. However, we are starting to get, with the acceleration of the vaccine supply, we are starting to get closer to kind of the bottom end of what the epidemiologists call herd immunity or community immunity. Now, with nearly a third of the population inoculated with the first dose, with about 40% of the adult population inoculated, and we would now estimate that we're approaching about 12% of the population with antibodies from prior infection. So, we're add the 30% vaccinated and the 12% with antibodies, you're getting to 42% within 3 weeks. I think we will, with 3 weeks from now, by May 25th, I think we will have inoculated another 650,000, maybe 700,000 people if the supply comes in on schedule. So, we're starting to get up there, really. I mean, we saw the numbers start to plummet in Israel and the United Kingdom after they reached about 50% vaccine-induced immunity. Here's my hope, Jeff. Here's my hope, is that the measures tonight, if people follow them and take this seriously, will at least flatten the curve and let us hope begin to move those numbers down. And once the numbers start to go sustainably down, then I believe we give the vaccines breathing room to take over and to then begin interrupting chains of transmission. That's our hope. That's what we're predicating this on. That's why we're saying 3 weeks. We do believe, we do hope that in 3 weeks, if the measures and the behavior can start to move the numbers down, then the vaccines start to make the decisive difference, as they have done in many US states and European countries. I'm just not going to take that to the bank because of the variant. Spencer Lalonde says, where's the science behind shutting down a church with no COVID super spreader, or are you the conspiracy theorist? No, Spencer, first of all, there have been multiple lethal outbreaks in faith settings, and people have died as a result of it. So I wouldn't, if I were you, make light of that fact. I have a friend who's a Catholic priest in a mid-sized city in Alberta who told me that there was a pastor of a different church who was in his church violating the public health measures and kind of was denying the threat of COVID. And regrettably, that pastor contracted the disease and has now passed away. So this is I remember I was doing a town hall with faith leaders on the telephone about 6 weeks ago, and one pastor called up and said that this was nothing more than the flu. And the next pastor, an evangelical Christian pastor, called in and said, sounding like he was death warmed over, sounding terrible, he said, well, if this is the flu, maybe I should come over and give you a hug, because I've got COVID right now and I've never felt worse in my life. So Spencer, I would not diminish this. Now you ask, what is the sense in closing churches that have not had outbreaks? Well, once you have the outbreak, it's too late to respond. I hope you appreciate that. This is about preventative measures, not reactive measures. Secondly, we are in a situation where the viral spread is so virulent, it is growing so exponentially, that we can no longer take the kind of narrowly targeted approach that has characterized Alberta's policy to date. We simply have to use multiple tools to avoid and prevent social interaction. And it pains me personally. One of the things I hate most about this is restrictions on the exercise of freedom of religion. And frankly, that is why, Spencer, in the past 14 months, Alberta has had the freest policy setting, the least restrictive measures on places of worship. This is the only province in Canada that has never closed churches and places of worship, that has always allowed at least some limited congregational worship, and has done so very intentionally. Um, and we are only taking this measure now because if we do not take some broad-based measures significantly to reduce social interaction at this point, uh, we are within weeks of overwhelming the healthcare system. That's not a model, it's not a guess, it's not based on assumptions, it's cold hard math. Right now we have 24,000 active cases. We know that about 3.6% of those will be in hospital 2 weeks from now, and that 0.83% of them will be in ICU beds 2 weeks from now. We can manage that with great difficulty. We can manage it by canceling surgeries, perhaps of some of your loved ones. Um, but if the growth continues at its current trajectory, and we end up with 30,000 active cases and then 40,000 active cases, then at that point, and that is not like that would happen in early June at the based on the current growth in cases. And if that happens, then our doctors and nurses in ICUs have to decide who gets care and who doesn't. One of the most painfully difficult conversations I've ever had to have in government was at our Emergency Management Committee of Cabinet about 10 days ago, when we had to consider a policy for triaging intensive care in our hospitals. So Spencer, I take it from your question, you may be a church-going person, a Christian presumably, and if that's the case, I would invite you to reflect on a foundational value of the Christian faith, and I think all faiths, which is the sanctity of human life and the moral obligation that we have, all of us, to protect particularly the lives of the vulnerable. I don't understand how we've ended up with people of faith prioritizing a kind of radical conception of personal autonomy and charter rights talk over caring for the weak and the vulnerable and protecting human life. So I can tell you as a person of faith that while this is a very difficult decision that I do not relish, I believe it is a morally, ethically, and indeed not just defensible but necessary decision. All right, Sarah May says, why won't you accept a healthy debate with the medical professionals that have asked to discuss this? Um, I, I do accept a healthy debate. In fact, Sarah, I think no government leader in Canada has done more to openly invite a debate on COVID policy. I've defended it within my own caucus under constant attack from the NDP and many in the media. I have constantly said that there is no one way through COVID. I have celebrated the fact that we have many Albertans who jealously guard their freedoms and are skeptical about the exercise of government powers. Um, Not only have I welcomed a debate, but I've engaged in the debate, Sarah. When retired Dr. Dennis Modry wrote me an open letter, I wrote him an open letter back. So I'm not just, not only have I not permitted a debate, I have actually actively encouraged a debate, and I have actively participated in and engaged in the debate. I think that hopefully the debate is good as long as it's based on facts. I'll just add this. One thing that concerns me is a lot of what passes for commentary in social media on COVID is not factual. It is made up, and that I don't think is helpful. All right, Amber Reddy says vaccine supply is a huge problem and failure of the federal government. Is Alberta in similar discussions to what Manitoba and Saskatchewan negotiated for truckers to get vaccinated in neighboring states to the south? Great question, Amber. Yes, the answer is yes. We have a discussion with the government of Montana on exactly that, and with another state. I don't want to reveal which one, but we hope to have something to announce in the near future. Amanda Tam says, why are you doing a Facebook Live but wouldn't allow questions after your presser? Well, Amanda, it wasn't a news conference. I wanted to make a statement directly to Albertans And we thought that the opportunity to do so on the top of the 6 o'clock supper hour newscasts would get infinitely more, um, get the message in front of infinitely more Albertans than at a regular news conference. So we might have, I think, 40,000 people watching Facebook Live during a news conference, but I was probably able to speak to upwards of 1 million people on the television newscast tonight. I have done, I think, 6 news conferences with the media in the past week. I'll be doing another one tomorrow to answer questions on today's announcement. And here I am answering questions from ordinary Albertans. And by the way, I often find these are more thoughtful questions than some that I get from the media. So Judy Darcy says, very disappointed about the reduction in outdoor gatherings. Why was this necessary? Yeah, Judy, it's a very good question because we do want people to move stuff out of doors instead of staying indoors. And, um, outdoor gatherings, if people are careful and they're physically distanced, are much lower levels or risks of transmission than indoor social gatherings for sure. But right now, we just need to do everything. Like, while they are much lower risk, they're not without risk. We actually have had um, a significant number of cases traceable to outdoor socializing, particularly, unfortunately, restaurant patios recently. And um, I guess, Judy, the way I would put it is this: if you've got a group, let's say one extended family or 2 household cohorts, and they're very careful and they're keeping a distance, that's fine. But you can see, I saw somebody shared with me a story about how they saw several dozen young people gathered in a parking lot having basically a tailgate party, and they were hugging and hanging out, arms draped over one another, and that kind of activity. That that is real risk of viral spread. And so, quite frankly, most, what the rules we introduced today are still relatively modest compared to many jurisdictions, compared to what most Canadian provinces have done at various times, Ontario and Quebec right now, most of Europe, many US states. So again, it's just an effort to do everything we can to limit opportunities for viral spread. Sharon Tkachuk says, please make sure you enforce these restrictions. People are laughing at Albertans' disregard for regulations. It's a very fair point, Sharon. And I know it's incredibly frustrating for all the people making great sacrifices to follow the rules, to see the flagrant violation that is happening. And that is why part of the package we announced today includes much stronger enforcement measures. We are doubling the minimum fine for a ticket for public health violations from $1,000 to $2,000. I will remind you that actually the maximum fine that is available for authorities to pursue is $100,000. Secondly, we have a new protocol that we've developed with all the police agencies, AHS, law enforcement agencies, Department of Health, and Department of Justice for a stronger enforcement protocol against repeat offenders. Thirdly, we are going to start using Alberta registries to ensure that we deduct we require that people pay the tickets that they have been issued. So we do expect to see a much stronger visible difference in enforcement in the coming days. And by the way, that's not to be mean to people. We've been criticized for this, but it's clear from the beginning that Alberta has taken a lighter approach to enforcement. The approach that we have sought to take has been, first of all, education. So if AHS sees a business that is in non-compliance, they go in, they explain the rules, they encourage change of behavior. If that doesn't happen, they've tried to move to compliance, which is, nudging more strongly, telling people that there might be sanctions if they don't shape up. And only then have they gone to enforcement. And perhaps some people have taken advantage of that more gentle and gradual approach to enforcement. But it is fundamentally unfair to law-abiding businesses, for example, if they're making sacrifices in how they operate, if the business down the road is gaining more trade by flagrantly violating the rules. So we can't, this is a country of laws, and we need to underscore that with stronger enforcement. All right, Ryan Knight says, who's vetting your teleprompter? Why avoid the masses with the real questions? I don't know, Ryan, do you have a real question? I just responded to yours. The answer is we've got a couple members of my staff. We typically get sort of 8 to 12,000 questions during a 1 hour session like this. We obviously can't answer all of them. All I ask them is to choose a representative sample of the questions that we are getting, some from the left, some from the right, some from the middle. I do ask them, by the way, we haven't taken any non-COVID questions tonight. If there are any, try to throw a couple in there, guys. So we try to do a pretty good job of that, and there you go. You got your question in there. Karen Casimir says, aren't gyms healthy for people? Is there a reason why they can't be at 10%? Good, fair, totally fair question, Karen. Yeah, gyms are good for people, and personal wellness can help, obviously, to make people, to improve their immune system and make them more resistant to infection. And so we do encourage people to get out and to get exercise. Certainly, that's totally permissible outdoors, and gyms can set up outdoor programs. I was out for my evening walk last night, and I saw that I guess a spin class had set up in an outdoor, kind of in a private park area, just adjacent to a restaurant. They had set up an outdoor spin class. So those kind of things can happen. We encourage that creativity. Properly distanced and all the rest of it. But there's two things that drive the transmission of this kind of respiratory virus. One is sustained proximity, being close to somebody who has the virus for typically 15 minutes or more. The general scientific guideline is if you are within 6 feet or less of somebody with COVID while they're infectious for 15 minutes or more, you are at a high risk for transmission. Or the other main source of transmission is physical exertion, which of course increases the rate of respiration, and with that, the volume of projecting droplets. The disease is transmitted through droplet projection. So in any kind of a gym setting, you're going to have droplet projection. You're going to have a risk of transmission. Fair point on the 10%. But folks, let me put it to you this way. As Dr. Hinshaw says, if we have a risk budget, we can choose to permit certain things, but not others. And we have tried to take that risk budgeting approach until now with targeted measures that have tried to keep gyms open on a limited basis and restaurants open on a limited basis, faith worship on a limited basis. But we're past that now. We've totally spent our risk budget. COVID is growing by 1.8% a day, by about 13% a week. We have the highest numbers in the entire pandemic right now. Our total active cases is twice as high as the national average in Canada. We are higher than any other jurisdiction in North America. If the growth accelerates and we end up with 3% daily growth, then we will be crashing our healthcare system towards the end of this month. So please understand, I mean, another way of looking at this would be to say, Kenney, why haven't you put us into a lockdown like other jurisdictions have done under similar circumstances? In Toronto, Montreal, for example, the United Kingdom, etc., people have not been able, United Kingdom until very recently, people have not been able to leave their homes since December, with the exception of urgent reasons. I mean, everything was closed, essentially. Virtually everything was closed in those societies. We are not there. And we're still desperately trying to keep this limited. We hope just over a 3-week period. So that's my urgent, my just request. I know this is incredible pain for the gym operators, for the restaurant operators, for parents who are now going to have to be at home with young kids, and I'm deeply sorry for all of those who are affected. But the alternative would be worse. The alternative would be, when we sit around there in the cabinet discussing these things, we don't start out by trying to damage any uh, business sector or group of people. But if we make all sorts of exceptions and just put endless holes in the public health policy, it will have no effect. At this point, there has to be a broader interruption of social interaction, of chances of transmission. That's what we're trying to do. Please, for just 3 weeks, if we start moving the numbers down, then the vaccines can take over with the critical mass of vaccines that we're receiving. Jasmine Rose says, will groups disregarding the measures such as protests and rodeos actually be fined in your new measures? Ultimately, that will be up to the police, but let me put it this way, Jasmine, they will have additional tools to do that. We're giving them additional tools and encouraging them to use those tools. I cannot, in a democracy, an elected official must never pick up the phone, call the chief of police in Calgary or the commander of K Division and say, I want these people arrested, I want that event blocked. But we can give them the tools, and we have a protocol now that, based on input from the chiefs of police, that will empower them with additional tools. John Melbourne says, here's a non-COVID question. Thank you, John. What's the status of the Alberta Fair Deal initiative? It's moving forward. Of course, much of that has been implemented. We will be appointing our Alberta Chief Firearms Officer in the very near future. We've passed the law. We've actually now set up the Alberta Parole Board. We have introduced the Citizens Initiative Law, which was part of our Fair Deal commitment, because that allows, it will be passed later in the spring session, that does allow Albertans, if they don't think the government is addressing an issue, including about our place in the Federation, they can try to force a referendum on that through that new legal initiative process. And we have won more autonomy from Ottawa in various areas by getting control over methane regulations, the regulation of major greenhouse gas emissions, the regulation of woodland caribou habitat in northern Alberta. They may sound like technical issues, but these are multi-billion-dollar issues that we have helped to save for the Alberta economy. We will be holding the referendum on equalization as planned in the fall. We are doing very deep and interesting research on the potential costs, benefits, and structure of an Alberta provincial pension plan and an Alberta provincial police force and other. So I think as soon as we get past COVID and into the summer, we'll be able to kind of refocus on that in a very public way. Jordan Smiley says, what about daycares and after-school programs? Are they considered essential? Yes, they certainly are, and so they are permitted to continue to operate under these guidelines. Again, the reason that we've had to go to a 2-week suspension of in-classroom instruction for K to 12 is it's about the capacity in the school system with 80,000 students, teachers, and staff on self-isolation right now. That number will continue to grow with the current growing case count. And so we are coming very closely to a point where many, many schools will not be able to operate with inadequate staff resources. So rather than kind of a slow bleed of shutting down individual schools or doing that on a school district basis, we just thought, based on the input we're getting from superintendents and school boards, to effectively hit the reset button across the K-12 system, 2-week breather, and then come back for a strong finish of the balance of the year. Tanya Belcourt says, lots of questions about what's going to happen to workers in camps up north. Can you please address this issue? Yeah, so unfortunately there have been some pretty significant outbreaks this last month in some of the oil field work camps up north. And first, let me just say, a word of thank you to the workers up there and the operators, the oil sands companies and the work camp operators, because generally they've done very well over the past 14 months. There have been remarkably few cases and outbreaks, even though people are living in pretty tight quarters up there. But what appears to have happened, in what I'm told anyway, by our northern health region officials, is that what I infer is that some people just were socializing without taking care after hours in the camps and weren't wearing masks and stuff like that. And the virus got in. Now, the other thing is, of course, a lot of people travel in from abroad, from outside the province, fly in, fly out workers. And it appears that some of them brought into a couple of those camps the P1 variant, particularly from British Columbia, which is far more virulent. And so that has affected some of the camps. I believe that some of the operators have scaled back their workforce. They may have also reduced some of their turnaround plans to reduce their staffing requirements. They've been working very closely with AHS to step up their health and COVID protocols, particularly in the camps themselves. I don't think the problem is outdoors when people are working in a mine or an in situ site. The problem is probably actually in the camps and socializing there. So we just ask people up there to be very careful. We did announce as one of our measures today that if if a business experiences an outbreak, that they will be subject to a 10-day shutdown or suspension, except for critical operators, and those would include the oil sands, because you can't just turn off an in situ project. It's just like technically almost unfeasible. You risk losing the entire reservoir. So we're not going to shut down those massive operations. We're just asking the operators to be especially careful. And we may also work with them as we're able to roll out vaccines with more supply to the general population to provide for targeted on-the-spot vaccine clinics in those work camps. We are surging more supply up to Fort McMurray, Wood Buffalo, and we're also lowering the age of eligibility to 18 for the region to address the outbreak in cases there. I'm past the 1 hour mark, but that's okay. I'd like to keep going. We're getting really good questions here. And I've got the time tonight. So John Timms says, Premier, with this latest set of measures, do you feel this will hugely impact Alberta's economic recovery? Actually, John, I'm not too concerned about that. I don't mean to minimize the economic impact, especially for people who are going to be getting layoff notices right now and in some of these affected businesses. But we hope it's going to be a month or less on these measures, first of all. Secondly, Alberta has generally had lighter restrictions than other provinces across Canada, and so we've been our economy and our labor market has been less affected by public health measures to date. And the overwhelming majority of the recession last year was not due to COVID public health measures in Alberta, but the collapse of the global economy and energy prices. I don't have an exact figure right now, but prior to today's announcement, we estimated that only about 5% of Alberta businesses were substantially impaired by public health restrictions, representing less than 5% of provincial GDP. So look, I'm not minimizing this. This is more sacrifice for some small businesses. Honestly, my heart goes out to them. And we would only do this if there was no realistic option at this point. All right, Rachel Hunka says, how many people are going to be hurt by pushing back surgeries and pushing the system back years and years? That is a very important question, Rachel. The answer is right now thousands. We have given AHS approval to postpone up to 30% of surgeries where necessary. My impression is that's the limit we're giving them, the maximum right now. That would affect thousands of people. The good news is that like a year ago, we did pretty widespread postponement of surgeries because we really didn't know what was coming at us, and we thought that we did widespread cancellation of surgeries. But we also then responded with a very quick surge in the summer and fall. And we caught up. I think we managed to catch up on about 90% of the surgeries that had been postponed. In addition, The Alberta budget for this year that was tabled in February includes a $1.2 billion increase in the baseline budget for healthcare, most of that devoted to reducing surgical wait times. Plus, there's a $1.5 billion healthcare contingency for COVID. And if all of that is not consumed just fighting this spike in cases, then we could redirect a portion of that COVID contingency fund to further surging surgery capacity. So the real answer to your question, Rachel, is how long will this take? If Albertans respond and they just stay at home as much as they can in the next 3 weeks or so, the numbers start to come down and the vaccines begin to beat the variants, then we can move, I believe, in June to begin some gradual reopening, and then much broader reopening in the summer, and then we can move to really urgently reschedule those canceled surgeries. But if this thing runs over a cliff, if people ignore all of this and the numbers continue to grow exponentially, then we're going to have to cancel tens of thousands of surgeries, and it will take us at least a year to catch up. Let's make sure that doesn't happen. Susie Rema says, can churches have an outdoor gathering option with more distancing between family cohorts? Susie, that's a good question, and I'm going to ask Dr. Hinshaw to respond to that. She's not with me now. I don't want to give you the wrong answer. Jasmine Rose says, are you concerned about interprovincial transmission? Let me come back to Susie. I think the answer is no, because we're just discouraging outdoor events. We've limited social gatherings to 5, so I should have been sharper on responding to that. I'm sorry it's late. It's been a very long day. We limited social gatherings to 5. I think a faith gathering would be analogous to a social gathering, and so I don't think that's prudent in the current spike that we are facing. But when we come back to relaxing measures, I think we can go stronger on bigger numbers outdoors for faith and other gatherings. Jasmine Rose says, are you concerned about interprovincial transmission? Yes, Jasmine, and clearly we have been affected by interprovincial transmission. The P1 cases that came from British Columbia. It's not blaming BC or anybody who traveled. We do know, though, that when the BC government kind of shut down Whistler about 6 weeks ago, that we see that there were a number of cases that went straight from Whistler to Banff. So it looks like when the party stopped in Whistler, some of the kind of ski party crowd literally just took a flight to Calgary and went up to Whistler and brought the P1 Brazilian variant with them. It's also clear that some out-of-province workers have flown into oil sands work camps, bringing the P1 with them. Again, this is not about blame, just telling you the facts. But having said that, I think other provinces right now are probably far more concerned about interprovincial transmission coming from Alberta to them than vice versa, given that their numbers are going down and ours are going up. Trevor, and there's been a lot of discussion between premiers about whether we should all come in with some hard restriction on interprovincial travel. While we are discouraging interprovincial travel, I just think it's practically impossible to enforce. Just think about the city of Lloydminster. Think about the Peace River country up in the north where people just go back and forth and they might live on one side and work on another. It would be practically impossible to have a rigid, sealed off interprovincial borders. On the other hand, they've done it pretty successfully in Atlantic Canada. Trevor Fickert says, how are you personally doing, sir? How is your mental health? Well, I've had better days, Trevor. I tell people that I've had better years as well. I'm pretty thick-skinned and resilient, thank God, to deal with the pressure. Thank you for thinking about me, and so I'm getting through it. I must confess, when I get when I have members of my family who start getting threats to them, that kind of does cross a line, and frankly, there's just a lot of craziness out there right now. It's unfortunate. Maybe it's explicable because just people are so tired of this. But some of the things that are being said and some of the threats that are being made are, I've never seen things like this before in my public life or my life as an Albertan or as a Canadian. So I'm certainly not asking for any sympathy. I'm just saying to people generally, can we all stop shouting at each other about this? The polarization in this debate I find sad. Um, you know, the extreme, harsh, judgmental nature of some of it. Um, let's all try to be a little bit kinder with one another. I think over until we're through this thing, which is going to be soon enough. I'm going to maybe take one more question, and I've now been at this for an hour and 10 minutes or so. Oh, before I come to that last question, could you bring up, somebody found me that Bowden quote. So I think the third question I got was from somebody asking if I had said that I don't like my party base or something like that. So that's a total tort, misrepresentation, falsehood. Uh, I said the other day speaking to my caucus, I explained how I'd been getting some pretty vile death threats, that members of my family were getting threatened, and then I also quoted the formal public statement from the organizers of the Bowden um, anti-public health event the other day. And I'll read this to you. They said, quotes, "We will not stand by idly and watch as not only our businesses, but also our Western heritage and more importantly, our basic human rights are ripped out of existence by the tyrannical beings of our current world." Could you actually put that up on the thing? Um, the tyrannical beings, not even human beings, the tyrannical beings of the current world. What the heck does that mean? I mean, are these people, is that now merging with the kind of David Icke lizard man conspiracy that I'm one of the tyrannical beings of the current world? What is that? So yeah, I said to my caucus, people who are making death threats against me and members of my family and are talking about the tyrannical beings that have taken over the world, no, they're not my base. They're not Albertan. They're not Alberta conservatives. They're not mainstream Albertans. Uh, they're people who need to cut way back on the caffeine, take off the tinfoil hat, and come back to reality. All right, a last question is Benjamin Huber says, "Who's to blame for the poor vaccine rollout?" Well, I don't think the vaccine rollout has been poor, Benjamin. We've vaccinated 1.7 million Albertans. We are consistently using over 90%. We've inoculated with over 90% of supply. Obviously, with supply incoming, there's always going to be a fraction of the supply that is in shipment and inventory. You know, you can't discharge 100% of inventory by the end of close of business every single day. It just doesn't work like that with a complex supply chain like this. Um, and I think it's gone quite well. I've heard very few complaints. I know that on the very first day, the first morning of the first day of bookings for the very elderly, the system crashed a couple of times, but the technology quickly recovered. I think we've had a very strong booking system since then. All I can tell you is that when bookings became open for people over 40 for the AstraZeneca, I went online at 8 a.m. that morning, got into the digital queue. It told me I had 7,000 people in front of me and it was going to take 17 minutes, and waited patiently. Then I filled out the form. I was booked for 2 days later. All of that was done in less than half an hour. Walked into the Edmonton Expo Center and um, went through the queue like anyone else. It was only a few minutes, and I did the pre-screening, got my jab in and out in 15 minutes. I think that broadly reflects the experience of most people. I know that there have been some bumps, particularly, for example, with the 1,300 pharmacy partners. Sometimes they've had to cancel booked appointments, but that's not because of the rollout; it's because of supply. Supply has been, particularly for the Moderna, and now for Johnson and Johnson, the supply has been often unreliable. But the biggest problem we've had, of course, has been just procurement. And I'm not saying this to finger point you, but you've asked. I mean, procurement is the federal government's responsibility. Um, we've ended up through much of the past 5 months ranking 40th or 50th in the world in terms of per capita inoculation because of the limited supply. And that is primarily because we do not have our own domestic production. There's a whole lot of reasons that go that for that. They go back to a lot of policy changes made in the mid 1990s that drove brand name manufacturers out of Canada because we changed the patent protection rules for brand name manufacturers. But look, the good news is we're now getting decent supply. In fact, this would be a positive note on which to end. Um, so, as of last night, like I say, 1.7 million inoculated, nearly 4 million with their first dose. We have gone further than other provinces on administering the second doses to the very elderly and people in long-term care, and that helped to give us an extra layer of protection that we were able to use to relax some of the visiting protocols around long-term care facilities. We have, let me see, just bear with me a moment. I know we're about to receive some significant supply. Oh well, I can't find this right now, but we've got some big orders coming in, and as I say, I think we can probably do about 600,000 in the next 3 weeks. Like we could actually do, here we go. So this week, we estimate that we'll be receiving 344,000 doses. Next week, 271,000. The week after that, 236,000. The week after that, 236. So, over 1 million doses coming on board this month, and we'll get those out in people's arms. So I should mention that we think we have the capacity to do 80,000 jabs a day. We've only been able to do 30,000 because of limited supply. So get us the supply and we'll get people vaccinated as quick as we can. These guys keep putting up more questions, which is fine. Ray Stinson says, lockdowns haven't worked. Why do you continue using this method? Actually, Ray, I would argue we've never had a lockdown in Alberta. We've had, for sure, some difficult restrictions. They've generally been quite targeted. I would define a lockdown as policies like stay-at-home orders and curfews, the closure of most businesses, the suspension of schools. Our schools have been open since last August. At the peak of COVID restrictions, 85% of businesses were able to operate. That's a year ago. We have never had stay-at-home orders. We've never had curfews. So, if you look at Alberta's policy compared to Canada, most U.S. states and most European countries, we've been on the less stringent side of the spectrum. But when we have brought in tougher restrictions like we did last December, it clearly worked. And so we are hoping that the measures we announced today will have the same impact. There is something in your question that I do agree with, Ray. I don't think that slogans like lockdowns work. I mean, there is a pro-lockdown part of the debate that have wanted to keep us, under lock and key for most of the past year. What I say to them is that stringency of the restrictions does not necessarily equal compliance by the public. And we've tried to be very sensitive to that in Alberta, that what we need is compliance and hopefully mainly voluntary compliance as opposed to just more and more rules. But at this point, we've run out of options because we have pleaded with people. We have pleaded with them over and over again to avoid social interaction and all these things that create spread. We have layered on more and more targeted measures, but those things have not stopped exponential growth, which accelerated over the past few days. So in my position, what are you going to do? Just keep pleading and pleading impotently on our way to crashing the healthcare system? Do you think any responsible person in my position would do that? I don't. So unfortunately, we're using the only tools left in the toolbox right now. All right, I'm going to call it quits there. We've done 33 questions, and I take it somebody wanted to know why I wasn't taking media questions. I had a news conference yesterday. I've had 5 or 6 news conferences in the last week, and I'm having another one tomorrow. So the media will get their pound of flesh, but we wanted to let Albertans go straight to the source tonight. I hope this was a good cross-section of questions. I want to thank you all for them. I want to thank you for your patience. Whatever side of this debate you're on, please try to treat excuse me, it's late. Please try to treat each other with kindness and patience. I know it might not seem like it right now, but we really are close to the end of this thing. We can just pull together, get over this last hill, and we'll be there. So thank you very much. Stay safe. God bless.